KellyVess, and today I would like to ask a would you rather question. It's a really interesting would you rather question. Would you rather use one treatment target in treating speech sound disorders, or would you rather use 10 treatment targets in treating speech sound disorders? So I ask you that question because it's not a would you rather question such as would you rather mustard or ketchup? Would you rather soda or pop? This is a would you rather meaning of life question. This is a would you rather, how are you going to make a difference in this world as a speech language pathologist question? This is the type of would you rather question that might seem very small, but have very, very large ramifications for the children we work with. So, would you rather use one treatment target, such as the word scrape, or would you rather use 10 treatment targets such as scrape, screech, scream, scrape, I'm trying to think of another word, screech. Would you rather to use 10 different SKR treatment targets? Well, I would say that you would rather use, or I would most definitely rather use one treatment target. Because if I use one treatment target for that entire year working with that child, the word scrape in the SKR blend is the most complex blend in our language. So we're going to have a cascading impact, and it's going to affect many sounds spontaneously. I'm going to use one word because when I use one word, I can take that word, I can throw that word into the child's court and the ball's in the child's court. The treatment target belongs to the child. And when that happens, the child is able to take on the role of teacher. And when we really want the child to take on the role of teacher, because when the child takes responsibility for the child's successes or failures, and the child knows that effort matters and that they're in charge of whether or not they're going to succeed or whether or not they're going to fail, this is a child that has a much better chance of having a great outcome in this child's life. So this child has developed an internal locus of control or self-efficacy in which the child knows that whether or not they're successful does not have to do with is not based on environment. It's not based on neurology. It's largely but based on individual efforts. So as a speech language pathologist, I feel it's the most important thing I could do with any and all of the children I work with is develop self-efficacy and letting the child know that the child is the teacher, that the child is in charge. And if I have 10 different treatment targets, I'm in charge. I'm juggling the balls. I have 10 different treatment targets and I'm having the child repeat these words here and there and everywhere. I don't want that. I want the child to be the teacher. I want the ball in the child's court. So that's why I choose one treatment target. And let me talk about that. You're probably like, well, what about the other words? Is that going to generalize? Here I have approximately 30 years of research with children in groups from 20, 25, 60 children in each of these groups that clearly states that a treatment target does generalize to untreated targets. So the research is here that yes, it will generalize. You don't need to do 10 different treatment targets and have all the balls in your court. We want the ball in the child's court. So what happens when I work on the word scrape for a year? First of all, I always work within a sentence because speech is a continuous motor act. So the child would say, can you scrape it to me, please, because I have angry dog teeth? And the child would say that all year. And the child knows that phrase backwards and forwards. And the child isn't thinking about what the child is saying. The child is thinking about how to say it. The child is thinking, do I have my tongue in the back of my mouth? Do I have a big snake sound? Do I have angry dog teeth? Do I have a big smile with the L? Boo. Do I have good bumblebees with the Z? Z. That's what the child's thinking about. how the child is talking, because the child is in the driver's seat and the child is the teacher. So that is what good therapy looks like, that does more than change a sound. We're changing a life. We're telling that child, you know what? You're in charge of whether you make progress or whether you don't make progress. And this is so important because we know that children with communication impairments, sadly enough, when we look at the longitudinal research into adulthood, they're more likely to lack self-efficacy as adults. They're more likely to think that they have control over their world. So we can make a difference, a really big difference early on, with something as small as the treatment target. Well, let's think about the treatment target SKR, and I want to let you know, how does it generalize? So I'm going to just take an articulation test here. This is the CAP2, and I'm going to show you what happens when I'm working with a preschooler with severe articulation impairment who has 20, let's say this child has 30 errors on this test, below 1 percentile, below standard score 50, below age 2 years, 6 months, at age 4.5. What could I do with this child? Well, I'm teaching the word scrape to the child. And what's going to happen is we don't change the trajectory of development that occurs across languages around the world. We don't have that power. What we do is we accelerate the gains. The gains are more quickly occurring. So I'm working on the word scrape, the hardest blend in our language. And what happens is, here we have on this side the singletons. These are the sounds, not blends, just sounds on their own. What's going to happen is the earlier sounds are going to quickly develop in. Then the stop sounds, then the fricatives are going to develop in, then the affricates are going to develop in. Then I'm going to have those late developing glides, the L, the R, and the TH. Those are going to be persistent errors, even though that's what I'm working on. And the reason they're going to be persistent errors is because they're at the top of the staircase. They're the most complex sounds in the language, and we don't change how children develop speech. We just accelerate the gains. So that's what's going to happen after 8 weeks of working with the child with severe impairment. After approximately 16 weeks, what I'm going to see is I'm going to start seeing these consonant clusters come in, not the late developing consonant clusters, not the consonant clusters that have the L's and the R's, not yet. What I am going to see is the simpler words, such as snake and swing. That's going to develop. I'm also going to get some assimilation when we have the word clown. We have the ka, the retracted tongue. So it's going to give me clown. With the word glove, I'm going to have the retracted tongue. So I'm going to get glove. Am I going to get flag? Probably not. You're going from F to L. That's very difficult. Am I going to get bridge? Probably not yet. B to R is very, very difficult. You have rounded lips going to retracted. So I'm going to get about 50% of the consonant clusters in the second semester. Now I'm at the third semester. Oh, at the third semester, these ER and EL words at the very end of words, the post-vocalic ER and EL are going to be strong. I'm going to hear dinosaur. I'm going to hear basketball. I'm going to hear really nice L's and R's right here post-vocalically. Those are done. Now I'm at the very end. What do I have left? I have my glides, L and R and TH, these very, very late developing sounds. That's how it generalizes. What am I going to do with the letter R? We've heard there's over 30 different variations of how you can produce the letter R. Now I'm at the top of the mountain, okay? I'm mountain biking. I'm getting off the bike. I'm walking at this point. Progress is slower, but it's still going to happen. This is when I'm going to use a sentence at the generalization level that uses different types of R's. Let me give you an example. Can you look at my R, look at my mouth, scrape it, or look at this R, spray it, or look at this R, drop it, or to me, please, because I have angry dog teeth. Now, when they have the angry dog teeth, they're really going to feel what a nice strong R feels like, opposite of being rounded, angry. So I always emphasize whether they're saying drop or spray or whether they're saying scrape. I hear the angry dog teeth because a lot of them round the lips. So that's what I'm going to do at the very end at the top of the mountain. And we'll use that same phrase over and over. They're going to memorize it, and they're going to be thinking about their angry dog teeth along the way. So I hope that you had fun today playing Would You Rather Speech Sound Disorders, choosing a treatment target with me. And I hope that you can think about the ramifications of the details of your practice and how important they can be. So think about it. Are you going to pick one treatment target or are you going to pick 10? So have a wonderful day. I'll see you tomorrow.